Hello everybody, good morning, good afternoon, good evening, depending on where you're listening from. This is Dr. Dekaifobi. I have been asked so many times about muscle cramps, so I figured I'd make a video on this because so many people do suffer from muscle cramps. What are muscle cramps? Muscle cramps can be described as a sudden involuntary contraction or tightening of your muscle that leads to pain. And it can last a few seconds, several minutes, and often is notable in the calves, feet, hands, and even thighs. Some people develop them more at night, and we call those nocturnal muscle cramps. So why do we have cramps? There are multiple causes. They include dehydration, electrolyte imbalances, which means you're low on magnesium, potassium, calcium, sodium, or even low in vitamins such as vitamin D. Now, number 3 would be overuse of muscle that can lead to that. So if you exercise intensely, that can lead to muscle cramps. Number 4, poor circulation. Number 5, medication side effects, such as some blood pressure pills and diuretics or water pills. Those tend to deplete electrolytes and can lead to muscle cramps. There are also medications taken for cholesterol diseases, such as statins. Those can also lead to muscle cramps. Some underlying conditions like thyroid disease, like diabetes, like chronic kidney disease can all lead to muscle cramps. And in women, pregnancy. Pregnancy can lead to muscle cramps. Now, sitting or standing in one position for a prolonged period of time can also lead to muscle cramps. So what do we do if we have them? Well, let's focus on this. If you do have them mostly at night, so nighttime leg cramps, you want to make sure that you stretch your calves before bed. You can do it on a wall or use a towel to stretch your calves. Keep the sheets loose around your feet so that your toes are not pointed downward. That tends to aggravate the cramps. You might want to take a magnesium supplement at night, which can sometimes help, and stay hydrated throughout the day. Now, if you don't necessarily have only nighttime cramps, you want to make sure that you're staying hydrated. So it's important to drink a lot of water regularly, especially if you're out in the heat, sweating. Coconut water is very good. Electrolyte drinks that are low in sugar. You don't want to start drinking a lot of sugary drinks. And what's so simple is just adding a little bit of sea salt in water. Pinch of sea salt in water, that can improve your sodium level. You can also take supplements of magnesium, potassium, calcium, B vitamins, or you can find those things in natural food. For example, magnesium is found in leafy greens, nuts, seeds, dark chocolate, calcium in leafy greens, almonds, dairy, potassium, bananas, avocados have a lot of potassium, sweet potatoes, coconut water. And of course, you can take B vitamins as well, which help with nerve and muscle function. So when do you see a doctor? If your cramps are frequent, severe, or last more than 10 minutes, you might want to see your healthcare provider. If you have swelling, numbness, or muscle weakness, you need to see a doctor. And if you're on medications that could be causing cramps, you want to discuss these with your healthcare provider. And if you have underlying conditions like diabetes, kidney disease, thyroid disorders, you want to see your healthcare provider. So again, talk to your healthcare provider. But hopefully you will have a more restful night, cramp-free. Dr. Dekaifobi, keeping it real. Have a beautiful, beautiful rest of the day.